In the name of Allah, the Beneficent, the Merciful, I am Professor Hamdi Amir Khan Ahmad, Dean of College of Health Sciences at Hawler Medical University from Erbil City. I thanks the organizers of the first international conferences in Kurdistan region who invited me to present a topic in this nice conference, and I selected this topic, nursing and culture, searching roots of factors affecting improving nursing in Kurdistan region as a new hypothesis. Why nursing and culture? Why I select this topic to talk about that? In fact, since 1998, which I returned back from the outside of the country, and at that time I had the BSc in nursing. Me and my colleagues as nurse leaders, we done many efforts to improve the nursing profession in Kurdistan region of Iraq, and in result, until now, we have these products. Now we have 4 public colleges of nursing and 3 privates was established in the universities. Advanced care wards and hospitals were opened. The number of nursing scholars with MSc and PhD degree was increased over the 150, and the nurses with academic degree occupied the administration position at the level of Directorate and Ministry of Health and colleges, and orientation toward the importance of nursing in health system increased during these years, and also the CPD units in health organization were opened and are rendering by MSc graduate nurses nowadays. But despite of all this, unfortunately, in general, we see that the quality of nursing practice is not well developed at the level of standard nursing care. Patient satisfaction is not at the high level. Nursing intervention are not evidence-based, and documentation of nursing activity remain poor. Moreover, this is interesting that there is no any apparent opposite law or regulation or documentation to restrict the development of nursing profession here. And almost all stakeholders or authorities agree that nursing is an integral part of the health system and has to be improved. So after thinking deeply about the cause why, despite our improvement, but we have poor nursing practice, we can say, or we can say at not standard level or international level. This is what was my conclusion, that maybe the cause is the nurses' background, culture, values, and belief, and including organizational culture. So if we talk about briefly what is the culture, culture is the patterns of ideas, customs, and behaviors shared by a particular people or society. This pattern identifies members as part of a group and distinguish members from other groups. Culture is dynamic and evolving, learned and passed on through generation, shared among those who agree on the way they name and understand reality, often identified symbolically through language, dress, music, and behaviors, and integrated into all aspects of an individual life. If we consider as the culture as the iceberg, you see that we have some visible aspects of cultures, which include dress, food, language, music, literature, residual games, virtual art, festivals, but we have a big part of that culture which is non-visible, and including the beliefs, values, communication style, handling emotion, notion of times, ethics, and many other things, which these visible aspects of culture depend on this big, large of culture that it's cannot visible. Whether culture have effect on impact on health or not? Yes, there is. culture have impact on the health. Why? Because health is a cultural concept, because cultural frames and shape how we perceive the world and our experience, and along with other determinants of health and disease, culture helps to define how patients and healthcare providers view health and illness. What patients and healthcare providers believe about the causes of disease, which diseases or conditions are stigmatized and why, what type of health profession activities are practiced, recommended, or ensured, how illness and pain are experienced and expressed, and where patients seek help, how they ask for help, and perhaps when they make their first approach. Culture is determined how is the patient interaction with healthcare providers, and the degrees of understanding and compliance with the treatment options recommended by healthcare provider, and also how patient and healthcare providers perceive chronic disease and various treatment options. Also, culture affect health in other ways, such as acceptance of a diagnosis, acceptance of a preventive health promotion measures, perceptions of the amount of control individuals have in the preventing and controlling disease, use of direct versus indirect communication, how accessible the health system is, as well as how well it functions, and also perception about the death and dying, and influences of family dynamic, and also perceptions of youth and aging. So as we see, the culture have many effects on the health. There is another things which is the subset of culture, which is organizational culture. And so what is the organizational culture and its relation to nursing? Organizational cultures includes norms, systems, vision, assumptions, beliefs, philosophy, and values that hold together and is expressed in itself, its self-image affects the way people and groups interact with each other, with client and future expectations. This behavior's pattern can be productive or not, and can lead to behavior and attitude that determine how the members approach their work and interact with each other. So in the professional field of healthcare, organizational culture has been positively associated with elements of organizational performance that contribute to quality of service, such as nursing care, job satisfaction, patient and personal safety, and so on. Furthermore, organizational culture has also been positively associated with financial performance. Nurses, as the healthcare professional, must actively engage in direct patient care, especially those working in the hospital setting, are an important professional group that can influence the overall culture of a health organization, positively or negatively. Accordingly, the culture of a healthcare organization can be a powerful characteristics that affect particularly hospitals, nurses, work environment, and enhance hospital ability to adapt to environmental change. Many studies show the effect of the culture on nursing performance and nursing values, and also organizational culture effect on nursing and nursing performance. But because of the shortage of time, I cannot mention all of them in detail. And this is the some review literature that show that culture and also organizational culture is the important factor in affecting the nursing performance and productivity. This study showed that organizational culture is a significant and substantial predictor of nursing professionalism. Only one study done in Kurdistan region by Dr. Al-Banna in 2017 and showed that he did her study his study, sorry, in on 54 nurses and evaluate their value regarding the nursing profession. 88% of nurses in that study, they perceived and know about the high value of their profession. As we said before, despite that, we have no good quality of nursing care in our hospital, and this is the question mark. Why, despite that nurses has good understanding about the high value, but why they are not apply them in their practice? So, what is my message? We need the assess of Kurdish cultural context and answer the following question. What are those ideas, customs, and behaviors among Kurdish people which affect the health attitude, health understanding, health practice, understanding of nurses toward their profession, the nurses' professional performance and productivity, and also find the answer of this question. Which aspects of cultural beliefs and values need to be reformed and improved? And what are the contexts of organizational culture of Kurdish health organizations and facility? What are the positive and negative factors related to organizational cultures which affect nursing profession and quality of nursing care? What are the barrier of practicing nursing profession values? How we can help our nurses to improve and apply the values of nursing profession? And many other questions that we can consider in an academic nurse. I encourage academic nurses to do the research about them and find the answer. In conclusion, I can say culture has a deep effect on health and healthcare provider professional performance. Researching Kurdish culture and understanding related factors affecting nursing practice in Kurdistan region is crucial for assembling a practical background that helps improve the nursing profession and practice it at a standard level. And also all Kurdish cultural values, beliefs, and habits and behavior have to be determined, and their effect on nursing practice has to be examined. These may help improve nurses' ideas, perception, decision, and action toward standard care, and foster nursing intervention and patient satisfaction in Kurdistan region. And thank you very much. If you have any question, I am ready to answer.